I am a 49-year-old female who was diagnosed with bladder cancer at 41. I thought I had a UTI, and I took some antibiotics for that. However, I learned after going to a urologist that I did not have a UTI, that I had a mass about the size of my fist in my bladder, and it was cancer. I ended up having to have 2 surgeries because the first one did not complete it. However, then I came to Dr. Sanfilippo here at this practice, and he was able to get everything. Every 3 months, I was having bladder tumors for approximately 8 years, and I would have them removed in the office. I'd have them removed as a 1-day surgery. And then ultimately, a tumor came into a place that was inoperable. And so Dr. Brewer said that I was going to have the major surgery, which I had fought for 8 years. I wanted to keep my bladder. And ultimately, I had it removed September 20th, 2010. Dr. Bivens and Dr. Brewer both had teams, and they operated on me robotically. They basically removed my entire bladder, and they took part of my intestines, and they made a reservoir or a artificial bladder for me to use, a neo-bladder. The quality of my life is excellent. The only thing I have to do is catheterize myself usually each day. I work full time. I have 3 children. I stay busy doing volunteer work, and also involved in several studies, and so my quality of life is excellent. After my surgery, it took me approximately 3 to 4 months, and I was performing my regular activities. There is nothing external that I have to wear. Everything that was done internally. I did, due to the location of the bladder, I had several other organs removed as well. That did not cause any problem. The scars are very minimal. You can barely see them. It's like having laparoscopic surgery on your knee or anything else. They're very minimal, and I attribute that to the doctors here. They did an excellent job. When Dr. Brewer told me that I was going to have the surgery, I had been investigating different avenues, anything I could do to save my bladder, because I did not want to lose it. I did not know what the future would hold. I did not know the impact it would have on my life. I called every woman that I knew of that had had bladder issues, and none of them had experienced this type of surgery. They had had the bags externally. I talked to a lady about that and determined that was not the way I wanted to go due to my age and my activities. So there was not anyone that had been through this. I had to go basically what the doctors had told me. To be able to go to the bathroom, on some occasions I can go normally like I would before the surgery, and then some occasions I have to catheterize myself. A lot of that depends upon your stress level. You know, if you become more stressed, you may have to cath more, but you know, you can urinate normally after you've had this bladder surgery. When I cough or sneeze, I do not have any leakage associated with that. The main leakage that I came across was at night during my sleep. At first, I started having to wear diapers, you know, because I would be in the middle of a deep sleep and there may be some leakage there. But the more I progressed, the less leakage there was. The staff here has been excellent. They've been very good, very willing to meet my needs and answer any question that I have. They are wonderful.